Hi, I'm Matt, and welcome to the Strong and Healthy Rehab channel, a place to discuss all things rehab. Today, we are going to talk about how do you go from where you are today, dealing with some sort of issue that's limiting your function, to sitting in front of someone like me, a physical therapist, ready to get you on your rehab journey. There are two ways that people end up in physical therapy. The first is through a referral. This comes from a different healthcare provider they write up what is called a referral, and they send it over to us, and we call you and get you in. The second one is what is called direct access, and that's where you don't have to see someone like a primary care physician or somebody like that, but you can go directly to a physical therapist and be seen and get started on your rehab. There are some benefits to both of them, some drawbacks, and some misconceptions about them, which we're going to talk about. The first one is referrals. That's the most common way that we get many of our patients, because many people, when they are not feeling well or they feel something is going on with their health, they go see a physician or a medical doctor. That's just what people do. It's not a bad thing or anything like that. Many people may go to their primary care first, and that primary care can make a decision on where to send somebody based upon their clinical judgment, so what they see going on. So that physician, that primary care, may have somebody with heart type issues. They may send them to a cardiologist. They could have stomach issues. They can send them over to a gastrologist, or again, any of that. And any of those physicians can refer over to physical therapy because they evaluate you, they listen to you, what the issues have going on, and they say, hey, I do believe that you would benefit from doing physical therapy, so we're going to send one over to this clinic that we know of. It's not just physicians, medical doctors, who can send referrals. It does depend state to state on the rules and regulations on who can refer to physical therapy. But physicians of all types can refer to physical therapy. Physician assistants can, nurse practitioners, chiropractors, dentists, psychologists, anyone like that. Again, it depends state to state, and many times physical therapists do understand the laws and rules and regulations in their state and can let you know if they can accept a referral from that provider. The second is what is called direct access. Again, that's when somebody says, hey, I have this going on. I want to go see a physical therapist directly. They can come in and be seen, evaluated, and started on their rehab. This does vary state to state. Some states do allow this. However, some states don't allow it due to the laws and regulations that have been passed. So speaking of both of these, there are benefits, drawbacks, and misconceptions about both of them. The first one that many people will say when you're comparing seeing a physician first versus a physical therapist first is they'll say, oh, go see the doctor first just to rule out anything bad, and they'll know what to do. While that can be true, however, very often many people don't have a serious issue going on that they really need to see a physician. Granted, there are special circumstances. Take, for example, if somebody is in an accident or maybe sustained a very serious fall. Yes, they would need to see a physician first to rule out anything like a fracture or any kind of internal bleeding or anything like that. If somebody has a very rapid, so a very sudden and intense onset of pain or losses of function like inability to walk or go to the bathroom, yes, seeing a physician first can rule out any kind of serious thing that's going on. An important thing that needs to be kept in mind is that all providers, physicians, and physical therapists, the thing that we are doing the entire time that you are seeing us from the first visit to the last is we are screening for anything that we call a red flag, which is a serious issue. So if you come in, we are looking from that first visit to that last visit. And if anything is not making sense or we're concerned that something serious is going on, we're going to refer you over to a different physician to be screened and make sure that nothing is going on. A drawback to seeing a physician first is that it can increase your overall cost for what you have going on, because you could end up seeing multiple physicians, waiting for tests, things like that, and end up in physical therapy anyway and have already spent thousands of dollars on it. Likewise, you could delay the care. You can delay that time that you start getting your function back, because you can go see one physician. They tell you, well, I want you to rest it, and I'm going to refer you over to this other physician who's a specialist. Well, we know with specialists, it's kind of hard sometimes to get in really quickly because they're so full. So you may wait several days, several weeks to get in to see them, and then they finally refer you over to physical therapy. And during that time, it could have been weeks, maybe even months, that you've been dealing with this issue. And finally, you can see somebody that can help you. So keep that in mind as well. A benefit for direct access is that you start right away in improving your function, whether that's decreasing your pain, increasing your motion, increasing your strength, improving your balance. Those things, you're starting on them right away. It can also save you money while you're not seeing several different specialists who just keep passing you to the next one. You go right to someone who can help you and can help you get your function back. There can be some limitations with direct access. Your state could allow direct access. However, going through your insurance company, the insurance may still require that you see a physician. If that is true, your physical therapist can talk with you about it and let you know that, yes, we will need you to get a referral for your insurance company. There you go, everyone. I hope this sheds some light on how you can end up seeing someone like me to start feeling better, start improving your function, because that's ultimately what you want to do. If you have any questions or comments, please drop them down below. If you enjoyed the video, hit that like button. And of course, please subscribe. I hope to put these out more and more, and that way that you can stay on top of the new content coming out. So I hope you all have a great day. You start feeling better. And as always, stay strong and healthy.